think we just want to start now, and it's a pleasure seeing you all. You are all welcome to our important Health and Adult Social Care Scrutiny Panel meeting today. As you can all see, my name is Dominic Mbang. I'm Councillor Dominic Mbang, and I've got my fellow councillors who have all been identified by their name tags, so at least you know who is sitting where. I know the cabinet lead for health and social care is possibly on her way, but I think we can start now because we've got an agenda that, okay, she's just arrived, that's great. Yes. So, just for the purpose of people who are here possibly for the first time, during the meeting, all participants will be in control of their own microphone. Please ensure that you turn your microphone on when you are speaking, and remember to turn it off when you finish. All reports published as part of the agenda will be considered as read by members of the panel. Published reports will therefore be summarized to allow the panel to focus on questions. Apologies for absence. I think I've got Councillor Nick Williams, Councillor Merrill. Is there any other person that I need to know, or anybody wanting to leave early? We are not actually, we should be able to finish in good time, so that shouldn't be a problem as well. Great. Then urgent business. There is no urgent business. Declaration of interest. Does any member have any personal or financial interest to declare on any items on the agenda? I see none as well. And as usual, I always say that I work with the NHS, so when I keep on going into some areas, just remember that I'm coming from the NHS. I physically actually came from the NHS this evening. Now, minutes. Members are requested to confirm as an accurate record the minutes of the meeting held on the 23rd of April, 2025. Are we fine with that? Excellent. And item number 5. Joy, you are in the house today, so thanks for coming. Joy Benson is CEO of Health Watch Greenwich. So Health Watch Greenwich will be doing a verbal update. To receive a verbal update from Health Watch Greenwich. And we have Joy Benson, who is here, CEO Health Watch Greenwich. So the microphone is...
Thank you, Chair, and I'm here to present our annual report. Hopefully you've all received links by email, but I provided some hard copy here tonight. I'm not intending to go through it. Hopefully you'll get a chance to have a look at it, but I do want to share a few things, and I suppose the best place to start is a quote from a local carer we supported. And this is something we hear quite a lot. So she said, "I didn't know what to do. I didn't know who to ask. It felt like no one was actually listening to me." So it wasn't I couldn't get through to the service, although we do hear that. It wasn't I had to wait on hold, although of course we hear that as well. But she was saying that no one was actually listening to me. And I think to put it in context, this was a mother, a full-time carer of a child with learning disabilities and physical disabilities. So she was dealing with daily health challenges that most of us, I think, would find very hard to even imagine. Juggling medication schedules, personal care, the needs of her other children, and her own exhaustion. And she needed help. And to get help, she did what she was supposed to do. She followed the system. But she felt invisible. So when she came to us, she wasn't looking for a miracle. She just needed someone to listen properly, without judgment. And that's what we did. We didn't fix everything. We don't have magic wands. But we made sure her voice traveled beyond that one call, beyond the complaint form, into the spaces where decisions are made. So what I'm really trying to say is that when you look at the report, behind every chart, behind every insight, every policy recommendation in our annual report is someone like her, someone who simply wanted to be seen, to be heard, to be understood. And I know that some of you might be thinking, well, hold on a minute, we're already listening. We've got engagement teams, we've got patient forums, we've got complaints processes, and yes, the system is doing a lot of listening. But for us, the question is always, who's missing from that conversation? Because the people who call us, they've often already tried the official routes. They've filled out the forms, they've emailed the inbox, they've picked up the phone. And still they come to us and they say to us, no one came back to me, no one followed up, or I wasn't believed, or actually I didn't even see the point because I tried last time, nothing happened, so what's the point of trying again? So what we do at Healthwatch, we don't compete with the system and the listening that's going on across the system. We hopefully contribute to completing it. We help to fill the gaps. We hopefully gather the quiet voices. And we're not here to duplicate what services already know. We're here to surface what they don't. And I think that's important because without that, the listening that the system does can become selective and perhaps not as effective as it might otherwise be. And I think something that we've all, come across in this room is the risk is that we start hearing only the voices that are easiest to reach, the voices that are loudest and not those who most need to be heard. So just as a quick recap, again, you'll find it in the annual report. So over the past year, we've spoken directly to nearly 3,000 residents. We've supported over 21,000 more to help to find their way through a complex and often confusing system. But numbers alone don't tell the story because our focus hasn't been on volume, it's been on who we're hearing from. As I've said, we've sought out the voices that are too often left out of engagement strategies and committee papers. The carer looking after a partner with dementia, barely holding on. The blind resident navigating inaccessible clinics alone. The young woman translating every appointment for her parents because no interpreter was available. The man sleeping rough, unsure whether it's worth registering with a GP because he can just go to A&E and be seen on the same day. And what we hear isn't just data, it's direction. It's insight with the power to redesign services, rebuild trust, and actually reconnect care to the people it's meant to serve. But the hard truth is, we don't hear from people at the start of their struggle. We often hear from them at the end, when they've tried every other route, when they've run out of energy or options. And I think that raises a question for us all. What might be possible if we built resident voice in from the beginning? And I know a lot of that work is happening. And some of my colleagues in the council now, are heavily invested in trying to build that in right from the beginning because they know and we know that when people are heard early, they don't just get better outcomes, they get dignity. So I won't carry on and say more. As I say, you can read the report for yourself, but I think for us, I'd like you to accept our annual report, and I'll leave you with a couple of questions actually that I jotted down earlier, which I think it might be useful for you to think about. So, of course, I hope that you're aware of the news that Healthwatch is being abolished and various functions are going to be merged into the council and the ICB. And I think that it will be useful for the committee to think about what would the future look like to build on the work that Healthwatch has done. Because I think, and I'd like to believe, that we'd leave behind a good legacy, so really some thinking about how that can be built on. I'd also like the committee to think about how the council and the work that's going on is evolving, how we listen to residents, how the lens is being widened, how the trust is being deepened. And again, I think the final point is really to emphasise the point that lived experience has to be the engine and the driver, not the afterthought of system change. So I'll leave you with that, and I'd ask the committee to accept our annual report. Thank you.
Thank you, Joy, for that presentation. Is anybody wanting to make a comment before we agree on the report? Yeah, go ahead, Councillor McMorrow.
Thank you, Chair. Thank you for the report, and you continue to be a strong and independent voice for patients, whatever their situation. I think what I'd like to ask you is, when somebody comes to see you, they have a thing that's uppermost in their mind, and they want a resolution for that. But is there also work, and how do you also relay to the people operating the system that something has gone wrong, that they've come to see you? Because, you know, in a way, there wouldn't be anyone coming to see you if everything was right, and no system gets everything right, and no person does either. But is there a space for you to say, why was this not picked up?
So we produce a monthly feedback report which gives some insight, the sorts of things we've been hearing and seeing in the previous month. I also attend a range of system committees and meetings, and obviously I use those as opportunities to raise concerns and issues and barriers and challenges that residents have brought to me. But beyond that, I've got very good relationships with system colleagues, some of them who are in the room tonight, so I'm also able to use more informal channels as well to, you know, raise concerns and challenges and barriers as well. So the system is responsive. The system, as I say, is as keen as we are to try and get things right. But as you know, it's very difficult, and everybody's working under pressure. Everyone's working under, you know, workforce constraints, financial constraints, so it's obviously difficult all round. But in the annual report you'll see impacts from some of the things we've raised, where services have been very open and changes have been made to widen access, to support residents more. And of course, I know that some of you here tonight as councillors I've reached out to as well to flag up some of the things that are happening for your constituents. So, yeah.
Thank you for the answer. Any further question from the panel members? Any question? Joy,
just to thank you for all your work, and we won't be getting this anymore then, will we? I look forward to reading that, but thank you.
So yes, absolutely. On behalf of the panel, I will say a fantastic work and a fantastic drive that you've actually gone on behalf of the residents. There are some of the loopholes that you fill in, as you've just mentioned, having the time to listen and to speak to people who live the experience that we'll possibly be hearing tonight as well is absolutely something that we are very grateful. And I think also you should start also thinking of what you can put in place with the fact that they are speaking of, you know, abolishing the drive that you were leading. How will you be able to make an impact? How will you be able to input into whatever is going to be put in place so that it's not forgotten? The work that you've done is not actually forgotten, or it's not just completely, you know, forgotten. And for that matter, I think it will be nice to start thinking also about that. And your questions you've put across, definitely we're going to be also speaking about it as we move through the year as well. Definitely listening to people and getting people to have trust is very, very important. And you've mentioned that lived experience is absolutely something that, you know, is the best example we can always work with. And of course, your monthly feed, information you used to give, and the surveys that you put across, we will also see how best the panel can come up with whatever can be put in place to support and whatever is going to be put in place. So do we agree, the panel members I'm asking now for their report for the annual report. Do we all agree? Unanimously agreed. So thank you very much. Yes. We will move swiftly to the next agenda, which is our cabinet member update, health, adult social care, and Borough of Sanctuary. To consider the cabinet member update report and to make recommendations to the executive if necessary. I would like to possibly just mention the names that are here. If people are in, we get to know that they are here. Is that all right? You introduce them as they come along. So, okay, the microphone is switched.
Thank you very much for having me. So I was just going to mention a few points, and then as the chair has kind of very aptly noticed, we've got some people with us here today. I think before, we wanted to basically bring some lived experience voice into the session today and have some people kind of speak to you. So I feel like it would be really interesting for you to hear that directly. But I just want to also say a huge thank you to Joy as well. I kind of echo the thanks that everyone, I think we can't, you know, can't actually see you there. You have made like a really brilliant contribution in all of the scrutiny and the many meetings that I sit on with you, and you provide great challenge. So I think it is sad there is a loss of the great work that you've done, but it's kind of a poignant moment that you're bringing a report today, but also kind of it is sad to hear that as well. So I just wanted to thank you and the whole Health Watch team for everything that you've done, and we will very much kind of keep in mind the points that were made earlier. So yes, so today just a few key points, and then I'm keen to kind of bring some more people here to speak to you directly. I think for me, one of the things that I have definitely felt about this portfolio since I've been learning, which is a very broad and complex brief, is it's all about people, but we so often, many of these reports can feel very technical or very detailed, and you can't feel, it very much aptly connects into the points that you're making about Health Watch and Joy's work. You can't see the people and hear those stories, and I think that really helps, and that's something that I've had real privilege in my role, to be able to meet people and see the difference that services that we're providing or our VCS are providing or in Greenwich, and how it really transforms people's lives. I think the other thing to highlight as well to the panel is obviously CQC are here, and we are in the throes of our CQC reassurance or assessment, so that's something to keep in mind as well. We've also, I'm very pleased we now have our Sam Bennett, who has been appointed as Director of Public Health, so that's a recent appointment, and really, really exciting to have that confirmed. As you know, following Steve's retirement, so it's brilliant to have her in post, and very much looking forward to working with her going forward. So what I will do is, and I think I'm really keen to move to kind of ask some of our guests, residents, to come forward and talk. So I think first we've got residents from Royal Hill who I think are going to come and speak to us, and I'll move to one side so you can use these mics. Just to give you a bit of context, Royal Hill is amazing home that's based down in Greenwich, and it is a home with support, but it's actually it's a community, and I've been there, and I've met the residents and seen the wonderful environment that they're living in, and I just think it would be really powerful to hear from them directly about the experience of Royal Hill and their home, and whatever you'd like to share with us. So if you'd like to introduce yourselves, and also if you just, yeah, actually I'll take another mic. Yeah, so just,
Hello, my name is Tom Hawkins. I'm from Wills in Greenwich, where I am. I was living with my mum and dad lately, and they've been doing all of the cooking, and trying to help me out and stuff like that. But now, more likely, I've moved into a new place in Greenwich, in 1B Penton Place. I've been there for a while, probably since in August time. So I've been doing my own cooking and been doing it independently by going out. I'm going to the gym on my own in buses, and I do a lot of powerlifting, so it's fun that. And then I work at the Old Royal Naval College in Greenwich, so I'm more like a bartender, doing some loads of drinks lately, champagne, wines, and any other sorts.
Can I switch the mic? Because I think that mic is...
And then what I've been doing is that I've been doing my weight loss program that I've been doing. It's more likely to be more healthier options of healthy foods, vegetables, and having protein and carbs. So I've been doing that all by my own. But I've been doing the weighing of my food. Yeah, that's it for me. Thank you.
Thank you very much for sharing with us. I think a big applause for. Thank you. Thank you. Thank you.
Hi, I am Aston Dolly. I am from Reels. Before, when I went there, I was living at home with my mum. She'd done mostly all the cleaning and cleaning all my clothes, making my dinners. And I'm just sitting at home doing absolutely nothing, just playing my PlayStation all day. and now what I'm doing is doing voluntary work and doing this weight loss as well. And I've been going out mostly like every day with my mate here, yeah, and that's it really. Yeah, oh yeah, my voluntary work I've been doing as well, so yeah. Huh? I just started doing my own cleaning, my own dinners and that, making sure my whole place is all tidy. Thank you.
Thank you for that.
Thank you.
It was just to add that you both kindly took me on a tour of Royal Hill, and it's a really, really beautiful place. Real community, as you said, friendships forming there. But also, this independent living facility was shortlisted for a LGC Future Places Award. We sadly did not win, but being shortlisted was still really amazing. We've got Casey at the back, who works with a team of people who provide lots of support. I remember you actually, I was at an event at the Royal, what was it, Royal Museums? Or?
I think it was a museum.
Yes, and I saw you with the champagne and we said hello.
Yeah,
It was
it
was very professional.
It was, I think it was called the Painted Hall.
Yes, I was at the Painted Hall,
that's the one.
exactly. It was brilliant. So it's such a brilliant place. And I feel like you seemed thriving, and I feel like everyone in Royal Hill seems really happy. So just think it helps bring to life. I think when people talk about housing a lot of the time, and a housing crisis, what we're not talking about is supported housing, and that's so important because it's about ensuring that everybody has a home, everyone can live independently, and you both talked about how you were not doing things that now you're doing, and you're all doing it all by yourself. And I've heard they're very good. I can't remember who's the cook, a really good cook, but one of you is a very good cook, I think, aren't you? It's him. But yeah, I don't know if there's anything more that anyone wanted to add. Go on, Casey, come on.
Yeah, really just to state also the joint community focus. So our guys at Reels have worked closely with organisations such as GLAB, Unity Works and Greenwich Cooperative Development Agency, who have provided cooking and nutrition classes, voluntary placements and access to work. So you've worked closely with them, haven't you? And that's been a real success. So real community effort on everyone's part. And just to introduce Andrew, who's the key worker to these two gentlemen, who's been instrumental in supporting them as well. Thank you.
Thank you. Thank you very much. Thank you.
Just 1 minute, somebody wants to make a comment before you.
Thank you. That was absolutely amazing. You should be really, really proud of yourself, because there's people that are living now, just ordinary people, that can't cook. I'm not a very good cook. But it must have been very strange for you at first, thinking, oh, I've got to do this. It must have been so... Boy, you must have thought, God, how am I going to do this? But you've been amazing, absolutely amazing. You should be very proud of yourselves. And with the help of your workers, so thank you.
Thank you.
No, that's absolutely great. Has anybody got further comments before we allow them to? Yeah, go ahead, Councillor.
Hi, guys. I just want to ask you each, what's your favourite recipe that you both cooked?
Well, the one that I always go for is spaghetti bolognese. It's my favourite one, with probably melted cheese on top.
Excellent.
My favourite recipe is making myself nice steak with vegetables and sweet corn and all that lot, and plus I have a little bit extra hash brown and that with it, so yeah. Yeah, I have a little bit of naughty stuff with it as well, so yeah.
That's what I do sometimes.
No, that is very exciting. Any further comments from any panel member? I think this is fantastic. The fact that you are being helped to live independently is the best thing one can ask for. And also, you are not just living independently. You've also mentioned to us tonight that you are doing something about taking care of your weight and eating healthy food, keeping your place clean. I think that is, if you are with your parents, definitely you'll be fighting every day about who should do the cleaning. But now you are taking responsibility about all that. That's fantastic. And for Andrew, thank you for also playing a big role in their lives in that capacity. So thank you very much for this. And I think that this can be rolled out to other boroughs, you know. Definitely it's a good model that I believe is a fantastic one. So thank you very much coming to share with us, especially the things that you have done and very successfully. Thank you.
Thank you. Thank you.
Thank you. And so another area that we really wanted to shine some light on was our digital healthcare technology service. So that's something that launched this year, and it's very much aimed at how we can better use technology to support residents to stay independent in their homes. So it could be lots of different things. It could be using video doorbells, using voice assistants, setting medication reminders, etc. So yeah, and a big thing is about supporting people to live independently. Again, it's kind of a very similar theme, like about people want to be independent, they just sometimes need a little bit of support to do it, and that can really vary. So we've got Jane, who's kindly going to come to talk to us about her. Yes, please, take your seat. So I'll hand over to Jane. Am I the only one? I think you are. It's special.
Press that one, don't I? It's on. Yeah, okay. Hello, everyone. I'm just going to do a quick intro to see who I am and where I'm coming from. I'm Jane Hopkins. I'm 78. I'm blind, and I've in common with a lot of over 75s, I have lots of comorbidities like high blood pressure, etc. So, I used to work as a psychiatric social worker in Greenwich back in 1971. So I've got 30 years as a social worker, ending up at the Maudsley in forensic psychiatry. And that was 30 years working for SLAM, and when I retired, I couldn't put the old social worker bit back in the box. So I sit on lots of committees and doing lots of service user representation and co-production, co-design. So I'm a bit promiscuous in that I sit with the new digital assistive team. I've forgotten what their real name is. Yeah, it's a long name. And I haven't got short-term memory, thankfully. That's the only thing I haven't got. And also the extra sheltered housing. But I'm very conscious that I represent the OV75s because, dare I say it, and hopefully it won't go further this room, I find Greenwich quite an ageist borough in comparison with Lewisham and Southwark and some of our adjoining boroughs, in that we don't have age-friendly Greenwich under the WHO age-friendly cities, and we don't have a mayor that represents older people. And this is the group that is the most resource hungry as far as hospital and social care resources are concerned. So if we can, and also the group that is not online, and that's a really key issue. It's fine if you're a white middle class with sharp elbows like me. I am kind of fairly proficient digitally, but there's a whole group whose voice is not heard out there of the over 75s, and there is actually no training apart from Learn by Way in the borough for this group of people who are digitally terrified. And I suppose I got involved in the new assistive technology design team last year, really to kind of look at what we can provide to help people remain at home and independent for as long as possible in reasonably good health. And that's for all age groups, obviously, which is not just for them, but also to relieve the pressure on carers, who are worried about if they're not living with their partner who may be disabled or in need of resources, technological resources. I've been working with Sam Bassett and the rest of the crew, who I feel are very open to new ideas and the slant that maybe a service user like me comes from. And I'm sure they're quite bored with me keep flagging up, but what about the people who are not online? These are the people who live in the most deprived areas, who are politically out of the system because they're overlooked. And Greenwich might be paper-free and digital by default, but that excludes a whole section of the most needy. And we forget them at our peril. And a lot of the policymakers here in Greenwich are very bright, thrusting 30-year-olds who have very little idea, unless they talk to their grandparents, about what it's like with compromised mobility, forgetfulness, etc. But anyhow, to get back to the digital, am I going on too long? Tell me to shut up if I do. I'll talk for England and Wales. But I think we're now moving into the position where we've designed the service, and we have to think about where we go from there and how we extend the service users group, and also maybe look at mapping the areas where we don't actually cover. And I think the information we're receiving on pickup of gadgets and technological help will actually show that there are certain metrics that aren't picking up on those or using that service, and that would again tend to be socially deprived and people who are not online, because a lot of the surveys when we started it up were online service, which necessarily excludes that kind of target group, if you like. But the whole area of digital expertise is becoming so much more important, especially as we move towards an integrated service. You know, we look at hospital at home for Oxley's, and we're finding out that certainly we're making great savings, financial, well, certainly the NHS is, in respect to unnecessary appointments with GPs, early discharge from hospitals so people don't become bed blockers or institutionalised. It's about and about avoiding unnecessarily hospital admissions. And I don't think there's many of us that actually like being in hospital food and sleeping in a hospital bed. I know that. If I can avoid that, I would. And certainly with Wes's Fit for the Future, who we all know about. I mean, there's that whole section, 1/3, about an NHS which is digitally based. And again, as far as I've read through the report, there's very little in there about people who are not online or who are digitally terrified. There's not much about care either. So I have to, next time I see Wes, I'll have to have a go at him. Is that it?
And is there anything, have you been using the service at all yourself? Is there any personal kind of,
sorry, right. No, I haven't, because I'm kind of, having had a kind of social work background, I know what I want, but I will be, and I'll certainly be using extra care sheltered housing, which will be a big expansion, another key piece of the frailty pathway for Greenwich residents. Yeah, I think that's it. I don't know if anyone wants to ask. I mean, it's about a personalised system, and that's what's so nice about the digital team, in that people have different needs and live in different contexts. And if you start from where the client's at, then you'll actually get a better result with people who are much more independent and self-monitoring and all to the good. And okay, the expense at the start might be quite prohibitive, but the long-term gains are kind of quite incredible if we're going to kind of manage to look after. I speak as an older person. I'm advocating on part of an older person. So I'll shut up now.
Yeah, thank you very much. Yes, go ahead.
No, I realised I forgot a key thing I wanted to mention as well. I think, as Jane already illustrated, we focus on a lot of what we call co-production, so working with, and it's a word that I have to admit I wasn't in my vernacular until I've started being in this role, and I hear it all the time now. So where we're working with people, as Jane has said, taking their lived experience, their voice, and building something with them, and it does take longer, but exactly as you said, you can have better results. But the one thing that I'd forgotten to flag is that this digital, I've had to look it up, Digital Health and Care Technology Service, we believe that, as far as we know, we are the only fully integrated joint initiative between a council and a local NHS service, which is really unique. A lot of others have either just done it as a council and not joined it together. We're quite unique in having roles like Lisa's roles, which are joint roles across both the NHS and the council, and having those strong partnerships, which has allowed us. So this has been a partnership, an investment from both of our sides to bring something that's integrated, because at the end of the day, the end user doesn't really want to worry about those bureaucratic kind of boundaries. A lot of the time it's about a holistic service so that both the NHS and the council can be referring into it and using it. And I think that was a key point I had forgotten to mention.
Yeah, and I think the key thing is that, you know, go back to the old adage, you know, no service is about me without me. It's really key because you can save yourself so much wastage if you actually listen to what people say and to make sure the delivery fits what the reality is, rather than having some idealistic thing that you impose on something that people will say will never work. That's not going to be picked up, you know. It's not rocket science.
Yeah. Yeah, thank you very much. That was absolutely fantastic to hear. Has any panel member got anything to comment on this digital technology, which of course is doing well? Yes, Councillor McMurrow.
Thank you. Hello, I'm
Hiya.
Matt. I used to work with lots of social workers, and it was always my impression that while you can leave a particular job, you can't stop being a social
No,
worker.
I'm still a nosy Parker, yeah.
Yeah.
Even though I'm 78.
Yeah, no, it can't be stopped. So could I ask you, we tell ourselves that while we're digital by default, there must always be a service available for people who are not going to use digital for whatever reason. Now, can I ask you what your experience has been in that? Is there a service available and a workaround, but it's a lot of faff, or have you found examples of where something is just too difficult to deliver, and we need to think more? We need to think again about how we provide things.
It's sometimes difficult to tell project managers, you know, you need a parallel service, you need hard copy as well, because one size doesn't fit all. And if you're kind of old, and we all come out of the GP surgery, and as soon as we pass the threshold, we think, oh, what the fuck did what did he say? I can't remember a damn thing he said. And the beauty of hard copy is that people can go back to it and reference it and read it again and whatever. And it's maybe fine for young people because their brains are more elastic than plastic, and they can learn things maybe quicker. But for us, as you get older, you have to go over things and practice things and whatever. Sorry, I'm going off point, aren't I, again? Sorry about that. Put it down to age.
Yeah, actually on point. That's not, yeah, that's fine. Yeah.
Thank you, that was very useful. Thank you.
And I just have to tell kind of young social workers or whatever, if you're writing something, designing a thing, go to your gran, ask your gran if she understands what's being said. You know, it doesn't cost anything. You don't need a reference group or I don't know. Just ask your family or your auntie or whatever and say, do you understand what this means? Or how do you do it? Sorry.
Oh, sorry.
Is that it?
No, I have one more thing.
Oh, right, okay.
Yeah, go ahead, yes.
I just remembered that, obviously, if the chair and the panel are minded, you have, and I thought I'd flag it to yourself as well, on the scrutiny plan you have age-friendly borough coming up in January 2024.
Yeah.
So save yourself for
excellent.
that.
Oh, that's
there could be a
really
really,
good.
really
I'm
good
so
conversation
pleased.
about that. Yeah.
Right. And can I just sort of bang in a thing that if you have time, go on to the website of the London Borough of Barnet, because they've got a really accessible website compared to our own, which is pretty poor, dare I say it. I might as well. Sorry, I hope I haven't trod on any toes here, have I?
Councillor May.
Thank you, Chair, and well said about that we're ageist, because I think we are.
Yes.
I'm in my 70s, my early 70s, so I'm not.
You're
quite
looking good for that. I might be blind, but you're looking okay.
And I've always been saying, well, what about the people who can't access technology, etc., etc. And I think it would be absolutely brilliant. But we need to get it out there more. Do the people that you're working with, do you hire the equipment to put into their home, like the digital, or, I mean, how does it work?
Shall I ask Lisa to come back in on this one?
Yeah, you can do.
Go on. Unless, Jane, do you know it?
Go on.
Go on.
I've spoken
But
too
well,
much as
but
it
well
is.
said. I agreed with what you said there, Jane.
I think it depends on where the person's at. Like, I mean, if someone's cognitively frail, then you may be looking at different kind of things like doorbells, you know, to make sure, and sort of GPS trackers, and I don't know, pressure mats and whatever. And if you're a young disabled person, it might be a different, you know, sort of smartwatches or whatever. So I think it depends. I mean, it's about, that's the whole thing about it, is personalising and starting again. You know, as I said, where the client's at and what their needs are. And obviously the basic assessment of need will actually pick up, hopefully, those gaps that can be addressed. Sorry.
Thank you for that. Because when I first started work, I was on a manual typewriter. Then it went to a little one that sort of like did a sentence, and then it went on to these big, massive computers, and now it's little iPads and things. So I've just sort of learned as I've gone along. But I can remember going to a typing training class, and you had to type to music, and it was raindrops keep falling on my head. It was looking back there, but we've moved on so much, and I think we need to get all of that out there. So, totally agree with you.
Chair, if I can just build on that question, that was a really critical question, and we had it recently when we met with the Department for Health and Social Care. To Mariam's point, we've got some interest in this service, but one of the fundamental things about it is the value for money, because these types of digital technologies are very robust in terms of how we can make sure that they fit people's personalised needs, but then they can be recycled. Yes. So what we do is we buy the stock, and we obviously personalise a range of those things to people's needs. They get installed, and then when people get a review and they don't need those things anymore, they can get recycled if they are still fit for purpose, and they're obviously cleaned up. There's a whole way of doing that with the partner that we've commissioned to work with us. So it's quite an interesting hybrid model, because we've got some of the services like the responder service and the monitoring of people's insights from what's happening in their homes as an in-house service, and then we've got a really fantastic technology partner who do the kind of personalisation and the installation, but they do recycle it. So we're looking for that kind of best value and cost, but also what are the benefits for people in terms of the independence and the kind of tweaks to their care and support that might come from it. So all of that learning we can bring back, I think, and savings for health and care, that's what we're aiming for, but not savings as in the cutting type approach. It's more about how do we get better value, but also people are saying they don't want as much care as they necessarily get at the moment, because they'd like to not have people always with them, and some of these technologies can complement other care. So it's exciting, and we're only 3 months in. So I think there's a big story to be told maybe in a few months' time about the impacts.
No, thank you for that. It's a bit like the young lads that we were here earlier, isn't it? They're sort of like moving on and doing things. But you say technology or to an older person, they immediately freeze, and it's not as bad as that. You know, you learn by your mistakes, but thank you.
Thanks for the answers. There was a hand here. Yes, Councillor St. Matthew Daniel.
Oh, yeah. I just wanted to ask you, you said there was one, that Greenwich, which was very ageist, and I just wanted to ask you, if there was one thing that you could tell Greenwich Council that it needed to change in order to attract the over 75, and that thing was cheap and effective, what would that thing be, do you think?
I would like to actually see, I mean, you have a young people's parliament, or young people's, I mean, I think that there's a role for older persons, because there's no older, Lewisham actually gives quite a lot of money to the Lewisham Pensions Forum and also to one of the other organisations that it runs. I mean, the Greenwich Pensioners Forum has always been a bit of a poor relation, not very political, not really an active group, and I think there's only about 20 people that turn up once a month. So there's no actual organisation that represents older people. And I think you need to remember, obviously, that we're a growing percentage of the population of Greenwich, with much more so than the young people and children, and we're becoming more frail, I haven't got the figures here exactly. So we really need, if we're going to make savings and to keep resources tight, we need to be thinking radically about older people's voice and listening to older people's voice. But then I would say that, wouldn't I? I mean, I think I've got a few more years before I fall off my perch, but...
Thank you for that answer as well. Do we have any further comments or questions? I would say we cannot do without technology, because that's what the world is now going on. So yes, I'm also concerned about the people that you've mentioned, like people who are elderly, people with disability, who might not be able to even use the technology. How we can go along with them is very, very important. Otherwise, I will give a very good an example where when I was mayor, I had the opportunity to attend
Greenwich Pensions Forum.
One of the forums, and this was in central London. It was actually about technology, and this is for people who are stroke survivors, that when, some of them loses their speech completely, they were able to get some apps that they put on, and one person can sit in the office and take control of over 50 people. It was so effective that I think we just have to continue to see what technology can help our people, especially those who are in dire need. Yes, so thank you very much for...
My pleasure.
Yeah, and a big applause for them, yes.
Okay.
I think I've got one more. Yeah. Okay. I've got one more.
Hold on,
bit.
we'll
Yeah, sorry.
finish and then you ask your question. There's another one more, yes, thank you.
So, no, and I think maybe, hopefully, kind of in the future, we could see if we can organise to take the panel out so you can kind of get a sense of show you the technology. I think something like that would be really helpful. So yeah, I think actually, as Joan is very, Jane has got her the Fit for the Future document in front of her. It's kind of made me think to just highlight as well some of the key aims that have kind of come down from the Darcy review that are represented in there include that shift from analog to digital, obviously taking into account, the protections that I guess we have to put in place around with that. But I think this project itself kind of is part of that, I guess, journey. And also that shift from hospital to community. And I think both of these examples that you've seen so far are all about how we can support people in their communities to stay and live independently as much as possible. And then again within that, I think that move from sickness to prevention, similarly, I think they're all part of supporting people to live independently. So on the final one that I wanted to show you to give you a bit of a flavour of the portfolio, and it's only just some of the things that are going on, is to highlight our work with Connecting Greenwich. So there's a lot of talk about neighbourhoods. You hear a lot of talk about neighbourhood working in councils and a lot of it in the ICBs and the NHS. And there's a lot of talk about it within public health. Our public health team have actually been doing what we would call neighbourhood work or a neighbourhood approach for a really long time. So we have a lot of, I guess, examples and case studies and experience in this space that we lent on probably during and just after COVID and until this day now. So it's been really helpful that with this shift that we're kind of building on that. So we've been making that progress for some time. So it's a lot about how we work where people are. And I think to the points I think Joy mentioned earlier is like what we don't want to be saying, like what, hard to reach, it's the seldom heard, and how do we make sure we're reaching those individuals. So I think I wanted to bring Sade? Yes. Sade in to speak about the work that we've been doing in Connecting Greenwich, and hopefully she can kind of bring it to life. Okay. Yeah.
All right. Good evening, everyone. My name is Sade, and I started a community interest organization in Greenwich. This was in 2021, and that was as a result of the increase in suicide amongst men in Greenwich. I saw an advert for community voting where you would present your ideas and you get the community to vote for you. So what I did was, and at the time there was pandemic, so it was done online. So I went online, I present my ideas that I want to raise mental awareness, mental health awareness. So fortunately, I got voted in. People, the residents, they buy into the idea, and I got voted in. To kick off the work with the community, Public Health referred me to take on a lot of courses. One of them is mental health first aider course. I did that. I did RSPH, Understanding Health and Improvements, which I did, and the certificate is accredited by Royal Society of Public Health. Also, I did a lot of courses which they referred me to. That gave me the confidence to actually register the organization, which is called CureCom. The name of the organization is CureCom. And with the funding at the time, I raised awareness in Greenwich Peninsula amongst men. I attended events. I rented a hall. And a lot of people didn't attend because people were shying away. And it's very, very difficult to engage men. I spoke to one of my contacts in public health, and I knew what was happening at the time because the adverts, the campaign material, all had mental health, the word mental health on it. And the council person, the public health official, told me, no, that must be the reason why people are not attending. So for future, I learned a lesson from that for future, I should try and refrain for doing that. Maybe I should get another name, maybe a friendly name, a catchy name. And that really was instrumental to the success of future projects. From there on, I named my project Live Life Projects. I did Live Life Project 22. In 2022, Live Life Project was very popular. It was held at Woolwich Library and also Plumstead Library. Public Health connected me to various services that I'm not even aware of, even though I'm in Greenwich. A lot of services. Live Well London, Greenwich Get Active, GDCA, a lot of services in the borough. And also at the time, they also referred me to do some courses on suicide prevention strategies, which was really, really instrumental because some of the men that attended had traumatic experiences where I held one-to-one with them. So from that training, I was able to hold a proper conversation and actively listen to their troubles because they are experts by experience. I'd listen. Where I can help, I help. Then also signpost them to other services within Greenwich. I also did Live Life Project 2023, where I got support. Greenwich again, Public Health again referred me to Greenwich Get Active, where they provided 6-month free gym membership, which was very, very instrumental. It was really nice. The men connected more, socially, because in the process, doing the gym, doing exercises, they were connecting, improving their health, losing weight. It was really, really good. We took a lot of pictures. It was really nice. Then I did my website at the time, put all the pictures on the website to encourage other men to join. Also, I needed, they also connected me to Oxley in Shooters Hill, Kidbrook, where I connected with a lady who came into the projects and carried out some mental health awareness workshops with the men. And it was, during the program, it was quite a bit traumatic for people who have gone through abuse and a lot of stuff in their lives. So they were like help at hand from the NHS to support them in maybe talking therapies, to support their mental health. So because of this, the community, they have trust because they've lost trust in the system. They've lost into the system. They don't want to connect, but because of this, because organization at grassroots is very important because you connect on a deeper level with the participants. They are able to talk, open up. Even though I'm a woman and it's a men's well-being, I have a man, you understand, like a volunteer who was fronting the project. But some of the men do, after several weeks, they were free, to open up and talk about their traumatic experiences, their challenges, abuse, female to male abuse, because all we hear of is domestic abuse for women, but nobody ever talks about male abuse, you understand? Even male carers, single fathers, nobody ever talk about that. So I got this help, all these supports, workshops, to engage the men. Also, I got people in to come and talk about prostate cancer because it's very important that men are aware of these issues and what to do. Also, diabetics, some men are speaking to me to say that they are diabetics, they don't know what to do, they've been given medication, and through this work, what I've realized is the medical model is good, but a lot of people get medicalized, and treating the symptoms rather than treating the root cause of the problem. And that's where the social model of treatment is very important. And I think public health, they are aware of this, and they give as much as support as they can. They also commissioned, recently, they commissioned Be Well London, who provides one-to-one support with community organization, signposting to resources, is really, really good and instrumental to the success of the work. I've got funding at the moment, so I do men's well-being every 2 weeks. And last 2 weeks, during one of the sessions, a man broke down and said he wanted to end it all. He ran outside, but luckily during the session, Greenwich Time to Talk was in attendance, a member from the Oxley. So she saw everything, how it unfolded. This man has already told me that his partner is moving out and he's been worried. So I told him that I'm going to refer him to the talking therapy. But on that day, he couldn't hold it anymore. So he referred urgently, you understand? So, he was fine. He still even attended. There was a community voting day as well last week, which he came to attend to vote because I wanted to do Live Life project for women. Because what I noticed that the men who attend the project, the partners, the wives, the mom, the sisters, they also like to come because they are carers for some of the men. And some of them will talk about suicide, and I cannot turn them away to say, no, we only do men's program. So what I did was to apply for the community voting day participatory budgeting. And yes, the resident, which covers Plumstead and Glendon, the resident came to vote. Again, I got voted in because, it's good for resident, giving the resident the power, you understand, to make a decision for issues affecting them and not the system. So they were there to, vote, and I got voted in. So these are some of the things that we've been doing in the community, you understand. And RSPH course, Greenwich Public Health, they introduced that again as well. So most of I announced it, and most of the members said they want to do it. So they went on and do the 2 days Royal Society of Public Health course. They were so happy because some of them have been out of education for 30 years. for 40, for 20 years. Some didn't even finish secondary school. That step, bold step to go ahead and do the course is life-changing for them. They were so happy, you understand, doing the course. They've gotten their results. Some of them, it's only 2 people that failed, and they are not even sad. They said they're happy and they want to redo, they want to do a retake of the course. So this has, you know, some of the, if I should start talking, there's a lot of story, you know, to be told. And like I said, men are very, very difficult. Sorry for men in the house. Men are very, very difficult to engage. There was this man that I've been talking to. I'm like, oh, you need to come to the project. You need to come. You understand? And what I did was I have a goal-setting book. It's not about attending the project and talking, but it's a structure in place. Because for me, how I learn is when you write things down, you tend to follow it. And I introduced this to the men, and this particular man I was talking about, he was reluctant. He came, he attended once. I never saw him again. Then I kept calling him, you know, messaging him, is everything okay? What I heard last week that he's got stroke. You know, unfortunately, he's in Lewisham Hospital as we speak. He's got stroke. That could have been prevented. It could have been prevented because I was telling all the men that Live Well Greenwich, they would come in to take everybody's weights, blood pressure, because some people have blood pressure, some people have diabetics, they don't know. So it's good to know and to take immediate intervention. You understand what I'm saying? And also, I would like to pass this around. This is a brochure that was published in, I don't have enough copies, that was published this July. That's the very first brochure, and also newsletter. The brochure tells the history of Kiocom, of what we do, and the newsletter is latest news, which is a new thing that I just did in this July. So this is my first publish. The newsletter is stories, what we've been doing so far, and the brochure is the story from 2021.
That's a very, very important information that we are hearing this evening.
Yeah.
Yes, Mariam.
Yeah, and thank you so much, Shola, for all of your work. I thought just to add, this public health do a lot of amazing work. A lot of the time it can sometimes be somewhat hidden. So it can be providing training, providing support to empower communities. So the Connecting Greenwich programme is very much about engaging and empowering communities, doing that really deep engagement, speaking to them, finding out exactly, as Shirley says, what matters to them, and then supporting them to deliver that. So not putting a service on over here and just expecting everyone to come and find it. It's kind of going out into the community. And within that, there's also this participatory budget process, which Shola referred to. So we've given out small grants for organisations who've got an idea, who want to make a change in their local area. And so I think in the region of £25,000 has been allocated, but the grants are maybe just £1,000 each. So lots of little projects. So again, could be a really interesting one that we can kind of come back or put it in a report for you so you can kind of see how those community projects have progressed going forward.
And one thing that I really like most is public health creating a delivery group. And delivery group is for organizations, community organization. So we meet once a month, and in the community is a space where there's a trust, where any issue arising, any challenges, because at the end of the day, we all have mental health. And it's good to unpick all these challenges during an open forum with other people who are also carrying out projects in the community. And you know, the delivery group is innovative because even if you have an idea, you need to make sure that the idea is better, strong. So I've been able to develop my ideas, stronger within the Plumstead and Glendon delivery neighborhood work. And yeah, there's trust. The connection is excellent because it allows me to connect with people on a deeper level. Anything I need, I know who to contact. You know, I know who to contact within the borough. If I need anything, anybody. Recently, Greenwich Get Active, they are coming to my project and they've offered 6 months again free gym membership. You understand? I've got a lot of testimonials. You understand? I've got videos where men are speaking and say, this is good, that men are depressed, and this is an outlet where we can talk, where we can achieve our, achieve our goals. So it's very important. A medical model is good, but for me, what I've discovered that they just treat the symptoms. You understand? During projects, sometimes during sessions, I would ask people, I'll be like, oh, what makes you feel well? People will be like, oh, connecting, making friends, going to the cinema. That's what, nobody ever said hospital, seeing the GP. Nobody ever says that. You understand that social connection is very, very important because you share ideas, you learn from each other, you support one another, you make friends. Is very, very key. And I think where I am today for this KIOCOM, it's been instrumental to the support I've received. I'm a registered social worker, even though I'm not practicing as a social worker. I'm currently working full-time as a civil servant with the Home Office, but I'm happy doing what I'm doing. I do it weekend, I do it Friday evening, because when you see the improvements, earlier on today, I attended a citizenship ceremony for one of our members. Earlier today, this morning, it was between, I think I got here like 1, 2, 3, yes, for one of the members. And when he joined the Live Life Project, when he joined, even though he has leave to remain in the UK, but he doesn't know that he needs to renew that under the European Directorate, because he got it under the European Directorate. So because of the link, Public Health has linked me to, they linked me to Migrant Hub. I cannot physically help him with that because of conflict of interest, but I referred him to Migrant Hub. Migrant Hub were able to help him in regularizing his stay. Now, today, he did his citizenship to become a British citizenship. So it's a milestone. These are the changes people are happy about. Some men are, would call me, oh, my landlord, I want to be homeless. I don't know what to do. You understand? Some will call me like 8 p.m. This is serious. Such men, they would have depression. You understand? They wouldn't be happy. You understand? But they want good quality of life. You understand? They want to be happy. They want improvement. They want to live life, but they are not living life. But through this project, and that's why I name it Live Life Project, through this project, I can see changes beginning to happen. I can see changes. Our next program is the 25th of July. So if anybody wants to attend, to come and see what we're doing, please, you are welcome to attend. We're based in Plumstead, St. John's Hall. That's where we're operating from. Gail Wallis has attended, Be Well has attended. Even before starting the project, I started with a community launch because the community must be involved in issues, in projects like this, to make decisions. What did they want to see? What did they want us to do, to provide? So over 100 participants attended. Is in one of the brochures, the pictures. So over 100 people attended, to give feedback, to give ideas, to give suggestions. And one of the suggestions they gave was, oh, we also want the women to attend, the women that is connected to the men, to the participants. And that's what I did on the 5th of July when I went for the community voting to get a bit of money. Even though it might not be much, it's 1,000 for each organization, but it's something to kickstart. It's something that builds trust, that gives the community trust that things are happening on the grassroots level. Thank you very much.
What we have been hearing is actually something that we want to make sure that the whole of the borough and beyond, that people are able to, because this is a preventive measure, and this saves a lot of money. If you think about one person getting sick for a condition that could have been prevented, it is absolutely very, very important. And I will ask panel members if you have any comment or something to add. You can do that now before. Go ahead, Councillor May.
Thank you, Chair. You've been extremely passionate, and what you're doing is so, so important. And I just, hold my hands up to you, and it's unless you've been depressed or you know somebody that's been depressed, you don't know what it's like, because they can't see forward, and they don't know what to do. So to have somewhere to go, someone to talk to, and I think that's always good. If you don't talk to, I mean, you do talk to your family, but then it's easier to talk to somebody outside the family, because there's those different views, but it's so, so important. So thank you.
Thank you very much.
Yeah, anybody on this side? Yeah, go ahead, Councillor Spencer.
Hi, I just want to echo what Councillor May just said. I can hear your passion throughout the entire time you spoke, and I'm honestly inspired by it. I see that the newsletter, this is the first edition, so, and I just had a quick glimpse at it. I really like the health tips as well. I will be using those. Adding some chia seeds and okra to my water, definitely. I see that this is the first issue though, and I was wondering, how often do you plan to do newsletters? And when you do, please include me. I'll give you my card after, or my email is also on the internet.
Okay.
But yeah, how often do you plan to do these?
I want to start doing it every 3 months. Yeah, because we have a lot of content and we cannot put everything in one newsletter. You understand? So we plan to do it every 3 months. Yeah, thank you. Thank you. So,
Will it be on your website as well?
I'm planning on uploading it I've uploaded the brochure on LinkedIn.
Oh, right, okay.
If you can find me on LinkedIn, please. My name is Shade Adeoye, and it's Cure.com. Yes, please like my page, comment.
Yes.
It's important to propagate your page. That's absolutely fine. You've already got followers automatically from what we've heard. Yes.
Thank you.
Mariam, you wanted to say something. Yes.
Just want to thank you so much, Ola. That was brilliant. It was just kind of like a final, maybe a final comment on. I think the portfolio is huge, but hopefully it's just given you a bit of a taste of like the many different kind of strands of work. The team is supporting everyone from people with learning disabilities, those with like a physical disability, those with living with dementia, and that old age piece we've related to mental health, addiction, we've refugees, asylum seekers, sanctuary seekers, and there's probably more. So that gives you a sense of how much, and today's just giving you a bit of a flavour. I think that within that, I guess the one point that I'm kind of, I guess it's a passion and an objective that both myself and Nick have, is we're trying to tell more of the stories of the people within the work that we're doing, because I think sometimes when we hear care or we hear adult social care, it feels really intangible. It's not something that people connect with, but actually care sustains everybody. Everybody in this room has been sustained by care at some point in their life, and we will need it probably at some point later in our life as well. And I think, as Shola's alluded to, that care and love and support can really transform people's lives. So I was thinking it's all about, and it's to steal a quote from, they talk about care supporting everyone, especially those to live a gloriously ordinary life. And I think that's something like that is really, really powerful. I've also, another thing we're working on is the vision, again, using really inclusive, accessible language so that it's something that when we talk about the work that we're doing, not only is it co-produced with people that use those services and it's a language that they would use and want to use, it's not something being done to them, it's about supporting them to live their lives. So just to, I guess, take into account, we're trying our best to demystify and, I guess, make care seem more central, because it is, alongside children's social care and adult social care, are one of the biggest parts of a council budget, but it is just often something that is not talked about, and I want people to talk about it more. So thank you.
Yeah, thank you. I will say, yes, before you go, we really appreciate you coming and to speak about this, because you've touched on a lot of areas which, as we are councillors, is very familiar. We come across that. When you think about some situations within men in particular, and especially when it comes to the minority group, when you link it to mental health, or even the prostrate you are speaking of, they wouldn't even come out to even talk about it. And in some cases, it's a cultural barrier. So to break through these, and you need to have trust with these people. And I think that you have managed to navigate on those areas. Reaching out to community leaders will be very, very helpful to be able to break through further, because it is important that, especially mental health, for where some of us are coming from, when a child has mental health, you don't want to let anybody know that he has mental health. You try to hide, you try to even not talk about it. So it is important that you are bringing these things out, because the earlier these things are brought, the better for the NHS and the better for public health and that of, the NHS as a whole. So thank you once more for coming, and the panel appreciates your presence tonight. Thank you.
Thank you.
Yes, I will ask panel members if you have any question for our lead person before we can allow any other person to. Is there anybody who wants to, from what we've heard this evening, if there's a comment or you have a question or there's something you want to add, that would be absolutely. Yeah, Councillor May.
I just wanted to add my thanks and to everybody that's spoken this evening, and to you especially as well, for all the work that you do, because your portfolio is extremely large and many, many different aspects. So thank you.
And it is important to know that, yes, reports are very, very important to know what is happening and the figures, but what we saw tonight is something that registers. It stays with us. It is actual. People have lived and they've come to express what, and I think more of these will be very helpful, and an opportunity to even visit them in their places. I think the panel will be even happy to see the operation areas where they work, especially the team that came first, that was in Royal Hill, to go and see what actually is happening. That is absolutely helpful. So thank you once more for this. We want to visit. Absolutely. So I will give opportunity to, now that, so we finished with that part, I would like to give opportunity to, usually all our panel days, when we finish our agenda, there is usually some 15 minutes we give to the general public to ask questions. So, Francis, yes, if you come closer. Come closer to talk, please. I think she wanted that while they were presenting, she would like to, they would prefer to ask the question rather than wait until the end of. But, we also have an agenda we have to follow, isn't it?
It's more appropriate in most meetings. You bring subjects up after they've just been presented or during the presentation. And so that's what I'm saying, not to wait at the end of the council meeting.
Yeah, Mariam, go ahead, yes.
Just to help, I think this one is a bit unusual because it's my cabinet update, so that it is one report.
But this is a statutory body which is supposed to be for the public, to bring things to the public, and the public for us to bring forward. Yeah. And if at the end of it all, so the people that have been presenting things are gone, and some may gone, and also it means that we've got to be here, whether we like it or not, till you're finished. You know, and we may find that coming along and hearing something and saying our bit, we've come along for the agenda. So I think it should be more 50-50 to consider the public as well as the your cabinet presentation. Yeah. So that's my position.
Okay. Thanks, Francis, for your.
So if you're going to lead to the meeting, I'll have to go.
Did anybody have any comment about that before we can? Yes. I think. Oh, you wanted to also come. Yes.
Do you want to ask a question? I'll speak after. But you can now. Okay.
Just mention your name and then. Sure. So that we'll be able to know who we are talking to.
Hello, Mr. Chair. Hello, panel members, and hello, everyone. My name is Ömer Aksoy, and I've got a son, 19 years old son, with progressive condition. I want to follow from my notes. I have a son with progressive conditions with complex needs. He needs 24/7 care. And I'm a parent carer with my wife, and we have no family members here. And we both have to look after him for 24/7. And we got a carer which has been allocated, 12 hours per week, which is not totally paid by the council. Part of it we privately pay her. And we are, like extremely tired, even our bones, physically and, mentally, because we do not have, respite care either. My son is 19 years old. Within 19 years, only 3 daytime by Demelza when he was a child he had, and 1 overnight. Could you imagine that we are basically forced to take break individually, not my wife and myself, together. And we have to, be away to recover from tiredness and renew our energy. At times I can't even, to keep up his medical, the appointments, because it's a full-time job itself, because of his complex needs, speech and language therapy, as physio, hydrotherapy, clinical appointments, a lot of them. And he was in education. He was doing creative media at London South East colleges and ERIF. And he couldn't progress to level 3 despite repeating the level 2 because of relating to his condition. He cannot do maths properly because he's a visual learner, because he has got an autism spectrum, so he cannot learn maths through conventional teaching methods. So because of that, he left the mainstream. He has to leave the mainstream education. Now, we have to privately, because he's a marvelous, in art. He's doing drawing and painting, and is wonderful, because of his visual, as I said, learner. And so we enrolled him in a Royal Drawing School, privately paid by us. That is online, so that means he needs, a PA care at home, personal assistance at home. Previously, when he was in main education, he had the college has to give the PA support there. So we are losing that entirely because he's leaving the mainstream education. We lost the EHCP as well. Joy, I think the CEO in health service was saying health care services are responding, in time. That's not true. We applied, for instance, CHC. We placed the CHC application in September, and 8 months. 8 months we had no response from that. I can, disagree with that. And then we only had yesterday a response, and that's a rejection, his CHC. So he lost, he's losing the EHCP. He has been rejected, and we don't have the respite care in place. And I am 60 years old, and my son's condition is, progressive, getting worse and worse, and we are not getting any younger. Could you imagine that? So we had, in September, applied number of, requests. That was one of them was because we had that housing as adaptation, and that was like by the builders not done properly, and there was, after 5 years, there were cracks on the external walls and the ceiling. So we applied to the council for the repair jobs, and this wonderful cabinet member, Mariam Laloar, helped us, and Nick Davis as well, I would say. And at the time, he needed transport services to college as well this year. So she really helped us in these 2 fronts. Thank you very much, Mariam, for that. And the other things really, like we had a number of social workers, they come and go, lots of changes, social workers. And with no really good communication records, you have to chase. And the people like, our circumstances, as I described, we don't have time for that. So we lose those services. The social workers could come to help us in time when we need it, but we are losing that, right? And like the politicians can make decisions, but we make life. We bring life to the community. My son is contributing in art to the community. Okay.
Omar, I think it is sad to hear your encounter and what you are telling us. Definitely, we've taken note of your question. We know the case in which we empathize with you of what you are telling us.
Thank you.
And luckily, we've got the cabinet lead for health and social care here. So this will be like a case that will be dealt with as a single case rather than speak about it in a panel like this. And I believe we also have the director we also have the director for health and social care as well. We spoke about the CHC definitely it will be looked at properly,
Okay.
and then they will get feedback to you.
Okay.
Because what is it is this is supposed to be dealt with as a single case and a case load for a particular situation which you have been narrating to us all along. So thank you very much.
I understand your point exactly, but you know, this speaks to so many families. It's not my specific case,
Yes.
and even you know, families in worse circumstances. You know, because we hear the stories like we go to my son's condition. There is a international conference. We come together, the all families, and we hear their stories. You know, and they got different circumstances. So that's what I wanted to emphasize, so as not to speak myself, but to the general.
And we do appreciate that. That is why I was just saying it was nice to hear what you go through. Because it's not just your son, it's for the number of families who are going through a similar situation.
Yeah,
As I speak to you, I'm a carer of 2 children with the same special needs. And when you spoke about some of the things of how you are not growing younger, it actually, I put myself in your shoe because it is not an easy task. When they are little and you are taking care of them, it's different when they're now grown. So your case is not something that we just only heard, but it will be taken as a single case and then will be looked at for people within that category, because you yourself will need to also be assessed to see how best you can also get help or respite once in a while, because otherwise there's a breaking point for everybody. So it will be taken as a single case, and I think if our what do you call cabinet lead will give your possibly pick up his number, that will be fine for you coming to share with us. We really empathize with it, but a lot of families are equally, and we know you are not speaking just for yourself, but for the rest of other people in the same situation. Thank you very much for coming to share with us.
Yep. Thank you very much for listening. Thank you. Thank you.
Also wanted to, yes, Francis, thanks for.
I think it's to give the information. I'm sorry, the lady, is it Jane who left? Because I had information that she might have found interesting as well as yourselves.
If you speak on the mic so that...
That's right, as if I'm talking to myself, which might be better. I'm a member of the Reclaim the NHS. It used to be Keep Our NHS Public, or the public bit is gone private, so we've reclaimed it. We're hoping to reclaim it. Just at the Pensioners Forum, when I stepped down in 2013, there was over 80 people, women and men, and very diverse. And we did a lot of protesting and activity, and we had the pensioners, the International Day of the Senior Citizens once a year and that sort of thing. So it's sad to hear how it's all demised. I'm sorry about that, very much so. So I just thought I'd let you know that it was a very powerful, effective and social. And we met with the social workers regularly. We put in a lot of opinions. They came to the pensioners from all the different committees to get the okay. They got a lot of questions. I don't know about the okay. But I don't think the pensioners voted so much on their life, because I believe in democracy. So I just thought I'd give you that bit of history. Now, Jane said that about the digital and online. I'd like to have the other opinion. I've said it frequently, a digital Luddite, but I've heard that being said on the radio by certain personalities, so I'm not the only one. I don't have a smartphone. I will not have a smartphone. I've got what they say a burner. They often say to me, what have you done today? I left Manchester for over a week. So you can forget where it is. It can be stolen. And also during the COVID period, the families that had either one in the house and none in the house, or they didn't have a computer. So a lot of people do not have the facilities And if anything happens to it, they haven't got the economics to do anything about it. But also, it's producing more isolation. And it's been proved in the younger generation, it also affects all sorts of your senses. You know, if you ask somebody where to go, the directions, they're not aware of. And this has been proved by some psychologists about the lack of awareness, etc. So my life since I've been retired has expanded with the people that are around me. And I know a lot of women, late 60s, 70s, and I'm in my 80s. So I think the IT world can actually diminish you. I'm not saying everybody, but it can diminish you. But I oppose that all the information from the Greenwich Council is digital. I've read the notices. Come and let us have your say. And at the bottom it says digital. I just laugh because you're not hearing us say you've got a digital require. There's no interaction. So I would request that there should be 2 ways, and that won't isolate. Also, we've got isolation from the senior citizens due to the changes since the 1980s. The luncheon clubs have gone. The home helps, which was essential, because the health visitors worked with the social work, the home helps, and the GP was connected as well. So it's prevention. Also, get the houses clean, because a lot of people, once you get, I've got spinal issues, you know, it's more difficult. And if you haven't got the cash to get some help in, it's really difficult to keep everything going. So I would say that we should try and get back to what is gone and why it was so good. And they were not isolated that they are today. Any of the senior citizens at home use the internet. They probably don't see anybody else. Is that good? The more people go out, the better they get, better communication. So I'm just highlighting these points. Now, she said that it was saving money. I've forgotten what way. But did you know that the NHS records, you know, your information is done by an American company, Palantir, and they've got a £330 million contract. They also deal with the arm trades as well, and American arms. That is, think of those millions being taken away from the British NHS. And that is who does all our digital. I mean, I keep on getting messages from guys to give them my information. They've got it. I won't give it to them because they want to put it on this American system. So our NHS is not as safe as it used to be. So I'm just pointing out. Also, the GPs now cannot refer you straight to a consultant, and the MSK anyway, I don't know about the rest. The Circle has to see them. The Circle they have to send them for the MRI, which is run in Queen Mary's by a private company, the Alliance, and private nurses. So all that money is leaving the NHS because they have to make the profits. And they then make the decision whether you can go and see a consultant or not. And they can say no. So our rights are being diminished day by day, and it's not the GP's fault. And the GP's money is not very much for the patients individually now. I don't think it's gone up more than £20 over the last 5 years per patient. So, and also the final thing is care at home after, after coming out of hospital. Now, what they've done, the powers that be, have put in electric and gas and cooking and washing into the economics of the house, the people. So if they haven't got much money, they're actually paying more, because when you're first ill and sick, you need that extra care. You feel more cold, you need the washing probably, it depends on what's wrong with you. So I personally think it's very wrong, because care is not when it's finished clinical, it's when you're clinical fit, which means the consultants are finished with you. But in actual fact, you need 2 or 3 days, not like it used to be, I admit, to recover enough to be slightly independent at home. So I'm not very happy about care at home. And as regards the orthopedic, the hips, etc., couldn't go home until they achieved a certain percentage of movement was measured. But now they're coming out with a bit of paper down in QE, no physio, Blackheath varies. So aftercare is not as it should, and that is why people are still not getting better, and the longer they are slowed down, especially as you get a bit older, then they become less mobile, etc. So I'd just like to point out that what's going on in there, if you weren't aware, which I'm sure you probably were, but the whole thing has changed. Nothing to do with the GPs. It's efficiency to save money and give the money to the private sector. It's almost gone, and you've been on the committees and it'll be documented. So I'd like you to double check your legal responsibility. As a panel, you're set up by the Parliament, so you're a statutory body, and you can pull anybody in to ask them questions. And the public's got a right to draw attention to it as well. And thank you very much.
Thank you, Francis, for all your comments. I think they have all been taken in good faith as well. We've got the cabinet lead here. He was listening keenly to you. We also have the director of health and social care. They've also listened to what you have said. We will definitely be looking at what you said regarding when people come to present, whether you can ask questions before they leave. We will.
There's no law. You have got a statutory duty and rights to run this on behalf of the people, to get information from us.
Yeah.
There's nothing laid down. We've got to wait. There's nothing at all. I can get the legal information for you if you need it. But before I go, I'd like to congratulate the CEO of HealthWatch. She was fantastic. She's doing exactly what should happen, and I was very impressed.
That's true, and that's the feeling of everybody. Yeah. So we just hope that whatever she was doing will be carried in a different direction, but not forgotten. So yes, thank you very much for your comments. On the 9th of October, meeting will look at the following: urgent emergency care and home affairs, health and social care integrated neighborhood teams. If you have any suggestion for the scope of these items, you may do so now or email it to Raymond. Kindly do so by Tuesday, the 22nd of July, so that we can finalize the scope and commission the report in time. So yes, that is the next agenda. That will be in the month of 9th of October. It will be the time that we'll be doing these two agendas. So feel free to send your comments. If you have any thing now you want to put across, we are also happy to take, so we can put it across by email. So thank you very much. And that's the end of the evening. Thank you for your participation. Thank you for coming. And let's continue to carry on with the work that we are doing, so that I think today has been a very, very fruitful one. The practicality of what we do, we saw today, and I think more of this will be very helpful. Thank you very much. Thank you, Chair. Thanks.